So let's go over what the actual procedure of circumcision is so you can see what will happen to your baby if you decide to circumcise your child. The first thing that happens with circumcision is that we need to numb the penis. So it's, honestly, in the old days, circumcision was done without anything to numb the penis. Nowadays, that's kind of frowned upon. So we like to do something, and there's really several options. One is to use lidocaine, which is the same kind of numbing medicine they use in your mouth when you have cavities filled, for instance, at the dentist office. And that can be injected into the penis to numb the penis. It's actually not injected right into the foreskin itself, but it's actually injected along the nerve at the base of the penis to basically numb the whole area. So that's one way, probably the most popular way that it's done. Another way to numb the penis is to use something called Emla cream, which is a lidocaine in a jelly, in a cream. And that's placed on the foreskin, on the penis itself, and left there for about 45 minutes. That also works very well. Now, the other thing that people have used is a pacifier soaked in sugar water and just have the baby chewing on that. And they actually did a study looking at the pacifier with sugar water, the topical lidocaine, and the injection. And they found that each one pretty much comforted the baby about the same amount. So in my practice, I use the lidocaine jelly. And the reason I do is that I think that the injection hurts. And so if the lidocaine jelly is going to work as well as the injection, why cause the pain of the injection? Now, the advantage of the injection is that you can do it and it works right away. And so if you're in a situation where you're sort of in a hurry or you don't have 45 minutes to wait, then the lidocaine jelly doesn't really work. So what we do in our practice is we bring the patient, we have the mom bring the babies in about 45 minutes before their appointment. The nursing staff then puts the jelly on the penis, and then 45 minutes later, I go in, talk to the parents, and then perform the circumcision. And we found that that works very well at helping decrease the pain of the procedure. And again, there are studies that bear that out. Again, there's nothing wrong with the dorsal penile nerve block with the injection, and that is probably the more popular way of doing it. The advantage of that is that it can be done right away and you don't have to have people waiting for 45 minutes. But for me, if you can avoid sticking a needle in a kid's penis, it's probably worth the 45-minute wait. So that's why I choose it that way. So anyway, the baby is numbed, and then we basically need to hold the baby down. And so we have this little thing here, which kind of looks like a medieval torture device. But basically, the baby's placed in here on a blanket, and then these little Velcro straps are put around the legs and the arms. And so it keeps the baby from squirming around when you're doing the circumcision, and it makes it safer. So the baby's put in that, and then betadine is put along the penis to get rid of any bacteria. And then the foreskin is removed, and there's different ways that people do that. Probably in the United States, the most common method is what's called a Mogan clamp, and this is a Mogan clamp. And the way this works is there's this little bell right here, and so the bell is placed on the glands of the penis, and the foreskin is pulled over this bell. It's then brought up through the hole, and so now you have the foreskin up here, the penis down below protected by the metal instrument. This is then clamped down like this, and what that does is it puts pressure along the area that you're going to cut, and it clamps the blood vessels down and decreases bleeding. A scalpel is then cut along the bell, and that removes the foreskin. Some people then will leave this on for several minutes. Other people believe that it can be taken off right away. I personally believe that it can be taken off right away. I haven't really seen any difference in bleeding rates doing it that way. It's then removed the same way I just showed you a minute ago, and the penis is then circumcised. Generally, there's a little bit of bleeding, but most times not much. The penis is then usually wrapped in a gauze that has Vaseline on it and handed back to the parents. So that's one method. Another method is the so-called the Mogan clamp, and this is an example of the Mogan clamp. This is the way that I prefer to do circumcisions because I think you get less bleeding. It's also faster, which is better for the baby, because if it was me strapped to a board having a circumcision, I'd want it to be as fast as possible. So what happens with the Mogan clamp is that the foreskin is pulled up through this clamp, and so you can see there's a little indentation that goes against the glands of the penis, and it's pulled across like that. It's then pushed down. This comes across and clamps it tight, And then a scalpel is taken and just cut right there, and that cuts the foreskin off. This big metal block protects the penis, and this is then opened up. Penis comes out without the foreskin, it's circumcised. Most people, and including in my experience, find that there's less bleeding with the Mogan clamp than there is with the Gomco clamp. Most doctors are trained on the Gomco, so this is what most people use, but this is another way of doing it. There's a third way that has pretty much gone out of popularity called a Plastabell, which is similar to the Gomco, where a little bell is placed and then a suture is tied around it, and basically you go home with this little plastic bell which eventually falls off with the foreskin. It works well, it's very safe, but most parents don't like having this plastic bell on the penis until it falls off, and so it's pretty much gone out of favor. But those are kind of the three most common methods of circumcision. Now, after the circumcision, the penis has the Vaseline gauze, and I instruct parents to leave the gauze on for a day. If it may fall off the first time that you change the baby's diaper, but if not, go ahead and take it off the next day. And then what you want to do is take a little Vaseline and put it on the end of the penis every time you change the diaper for about a week, just to keep the penis from sticking to the diaper. It takes about a week for it to completely heal up. There will be a little scab, and that scab is going to get a little goopy when it gets peed on. That's all normal. It takes about a week for that to completely clear up. You want to clean the baby with a wipe, with a diaper wipe, just like you normally would. Keep the penis clean. Don't be afraid to clean the area. It's actually very important because you want to get all the poop and pee off of it. You might notice some spotting of blood on the diaper. Completely normal, nothing to panic about. Now, if the diaper fills up with blood, that's not normal. You need to take the baby in right away. But imagine that you scrape your pants, and there's a little bit of spotting on your pants where the scab is. That kind of thing on the diaper is completely expected. The things to watch for: excessive bleeding, you'd want to bring the baby in right away, or if there's signs of infection. If there's pus coming out, if the baby gets a fever, if it gets really red and angry looking, that could be a problem. You'd want to bring the baby in. So that's the circumcision procedure. Most babies actually tolerate this a lot better than you'd expect. In my opinion, it's usually a lot harder on the parents than it is on the baby. Afterwards, the babies generally are not in any pain. Sometimes they're a little mad because they don't like being strapped down, and honestly, they cry more about being strapped down than they do about the circumcision procedure itself, mostly probably because the numbing of medicine works quite well.